My name is Raquel. I'm from Jersey, and I came to pelvic rehabilitation because I was living in chronic pain for 2.5 years. It was hard, obviously. I felt like no one could understand or relate to what I was going to. I felt alone, especially after being rejected from so many doctors who were just basically either telling me, I think it's just stress, there's nothing wrong with you, or I think it's a psoas strain, I think it's a hernia, I think it's this, I think it's that. It's always like, I think. After seeing many doctors for about a year, the PT I was seeing at the time suggested I go to this one doctor and kind of do a full evaluation. And that doctor did a full evaluation and really didn't see anything wrong with me. He was basically like, listen, you're in totally good, healthy shape, but I know you're living in pain. I know there's something wrong. I had referred another woman similar to you to this practice called pelvic rehabilitation, and I think that you would really benefit from them. So I suggest you go see them. First thing I did was like Google, right? And I went onto the site and I was like reading about, patients and what they do and what they specialize. And I was like, no way, this is not me. Like, I'm now going to go to another doctor who is not gonna know what's wrong with me, and I'm gonna be basically back at square one. I was like, but you know what? Like, let me just do it. Let me give it a shot and let's see what happens. So calling the office and the facility was pretty seamless. They were really nice, just very kind and patient. I never felt like they were rushing me or there weren't enough availabilities. Just knowing that they were kind of just giving us a level of attention and treatment that I hadn't experienced with another practice I was like, okay, this is a good sign. When I first started coming here, I was actually seeing Dr. Hill, and she's now down in Florida. And I remember coming in for my consultation and meeting her, and her just being super kind and bubbly and had a really great warm presence to her. And she was like, okay, listen, I'm gonna sit here and you're gonna tell me everything from top to bottom. Nothing's too small, like feel free to add any details that you think may be helpful. So I sat with her for almost an hour. And after I had shared my story with her, she straight off the bat said, okay, I definitely think you have endometriosis. And I looked at her and I was like, no, I don't. And she was like, I think so. She also did share with me at that time that she had also experienced endometriosis herself. So she understood the level of pain that I was in. She was very familiar, felt very much so I was talking to somebody who was like, oh my gosh, for the first time, she gets it, someone gets me. And I was like, okay, well, what can we do first before we start exploring surgery and all that? And she was like, okay, sure, we can start with treatment as far as injections, which will help kind of relax the nerve and the muscles in that area that's giving you a lot of pain. So we did that, and that helped. But as I resumed living my lifestyle as working out or hiking, it just always it was like hitting the reset button. I think it came back after the holidays, and I was like, oh my gosh, my Christmas and New Year's break was terrible. I was just in pain the entire time. I trust you, you know best, let's do this. Who should I see next? I had surgery March 7th, 2019. So it's been a little bit over a year. The good news is that they removed the endometriosis. So yes, I did have it. I'm just happy now to be at a place a year later where I'm pain-free. I tell them all the time here that they're my dream team, because literally without them, I don't know where I would be. This is my home base. I'm so grateful and blessed to have them in my life, because I don't know where I would be if I hadn't stepped through these doors. So yeah, they're the best, hands down.